Hello. I'm Sam and I am a lung cancer clinical nurse specialist. As a clinical nurse specialist, or CNS, my main role is to provide support and education to patients and families who are being investigated for or diagnosed with lung cancer. My team is responsible for triaging and processing referrals, and we are involved at the very start of the patient pathway where investigations are organised to try and reach a diagnosis or rule out cancer. When speaking to patients who have had a referral, we assess their symptoms and check if there is anything new or different to the information we have been provided. We then arrange their CT scan. If a CT has shown a suspected cancer, an outpatient appointment is arranged to discuss further investigations. A CNS will aim to be present at all outpatient appointments for these patients. As we know, there are understandably high levels of anxiety at this time, so we know it's really important to have a CNS involved to support, reassure, and be a listening ear. We also support patients on wards where any discussions about lung cancer are taking place and continue to provide support from this point, ensuring they have our contact details. We can also help to facilitate early discharge where this is appropriate. Another part of our role is attending the weekly MDT, which I know is already being explained today. We also carry out nurse-led clinics, which I will go into a bit later, and we organise and participate in regular patient support groups. So what does a typical day look like for me and my team? I start each day by checking the diary, looking at my emails, and also making sure there's no messages on the answer phone that need urgent attention. I also have a look at if we've had any referrals from the wards that have come through. These will help me to prioritise my day. We have an outpatient clinic most days, and therefore I'll have a look at who I'll be meeting in clinic, what the background is to each patient, so I'm well prepared when I meet them. This could include making sure I have relevant information with me that needs to be passed on. This might be in relation to investigations that are needed or about a diagnosis that is being given. When I go to clinic, I'll normally be with the respiratory consultant throughout the consultation. There is always an opportunity after this consultation has taken place for patients and their loved ones to spend more time with the CNS to recap on what has been discussed and, if needed, answer any further questions. This is also an opportunity to give patients a bit of space and time to absorb the information they've been given. After clinic, I write up my notes and ensure that any relevant referrals are made. When not in an outpatient clinic, I'll be looking at the referrals and triaging these and arranging scans. I would also see any inpatients that need a review or support. Twice a week, we run a nurse-led telephone clinic for all newly diagnosed patients, in which we offer further information and support. We'll carry out a holistic needs assessment at this point. And this also gives us an opportunity to pick up on any issues that need addressing, any new symptoms or any referrals that might be needed to other healthcare professionals. Once a week, we have our main lung cancer MDT, and we've already heard that there's a lot of preparation involved in the days leading up to this by the whole team. Anyone who has had a referral and a CT scan should be listed for what is known as the pre-diagnostic MDT, and we need to ensure the scan has been reported in time for this. We then look through the reports to see whether a cancer is likely and more investigations are needed, or where the cancer can be ruled out. Throughout the day, we'll continue to check emails, referrals, and the answer phone to keep us up to date as possible. Being one of the lead nurses for the team, some days I will need to look at the team roster, plan the staff shift pattern, and also look at training courses, appraisals, and annual leave. I'm also asked to present at educational events and conferences, so we'll sometimes need to do some preparation related to this. I also spend time organising and planning our regular patient support groups. This last year, we re-established our face-to-face support group, and I've witnessed how beneficial this is for those affected by cancer. So what motivates me to do my job? I feel this role is very rewarding, in that I'm able to help others at a very challenging point in their lives. I feel passionate about improving their experience during this difficult time. I'm very lucky I work within a wonderful team who are all striving to achieve the best they can for patients. Thank you.
Thank you, Thank you, Sam, for talking us through the CNS role. I think the clinical nurse specialist is the glue, really, in the clinical team in cancer care in terms of holding things together. And really that link and the patient advocate. And patients, in my experience, patients will often tell the CNS things that they're too scared to tell me as a consultant, but are, as important as any other aspect of their care. So moving on, I'm going to invite Dr. Jenny Nobes to come and talk to us about her role as a consultant oncologist and service director for oncology.
I'm Jenny. I've been a consultant here at the NNN since 2010. I'm from Norfolk originally, and although I didn't train as a doctor here, I really wanted to always come back here and work and help improve things for the area I grew up in. I've been lead of the skin MDT as well since 2015, and for the past year I've also been oncology service director. So as an oncologist, we see people who've been through the earlier parts of the pathway. So I see people who've already had biopsies, scans, who've been discussed in MDTs, might even have had surgery as well. So there's a lot of information to collate before we see people in clinic. And because oncology is such a massive specialty, we all specialise into areas within it. So I treat people with skin cancers and prostate cancers as well. So I give people radiotherapy, chemotherapy, immunotherapy as well. So it's a very busy job, but really interesting and really rewarding, and things change all the time with the science. So no 2 weeks are the same, really. It varies all the time. So my week's pretty busy. So I start at 8 on a Monday doing the skin MDT, which lasts for a good 2 hours, really. It's quite big. And then I've got clinics to do, radiotherapy planning to do, and it's a very clinically based specialty. So I spend a lot of my time in clinics, in radiotherapy or on the wards. Since being service director, I've got a lot more emails and meetings to go to, and I do that a bit later in the week as well, but it's a constant job. And as service director, I work with the senior management team in oncology to help to oversee the smooth running of the department. So it's a really rewarding job that I like doing, as well as my clinical work. I'm lucky to work as an oncologist with a whole range of people, from CNSs, therapeutic radiographers, pathologists, dermatologists, plastic surgeons, urologists, a whole range of people, and that makes my job really interesting as well. I'm motivated to come to work by the fact I meet different people every day. No 2 days are the same, and I have the opportunity to change the course of disease in people, from giving curative treatments to, even if cure is not possible, to giving treatments that improve quality of life and maybe extend life, and that's an enormous privilege for me. I'm really lucky as well to work in an amazing team of people who are all committed to delivering a world-class service. Despite not having enough time, money, space, equipment, everyone is so committed that I think we do deliver that service. Thank you.
Thank you for that, Jenny. So as service lead, the oncology service does provide different treatments, including radiotherapy and chemotherapy. So I'm going to ask our third patient representative, who's Susie, who's going to tell us about her experience of chemotherapy for bowel cancer, please.
Hello, everybody. This is the first public time I've ever spoken about my cancer journey, so I'm going to do the best that I can. My name is Susie. I was diagnosed with stage 4 bowel cancer at age 41. At this time, my 2 daughters were aged 13 and 10. I had very few textbook symptoms, to be honest. Following on from Erin's symptoms, I didn't really have any of those. I had quite persistent feelings of bloating. I began to retain fluid. My stomach started to swell. I lost appetite. And unlike Paul and Tracy before me, my pathway didn't involve waiting for diagnostic tests and appointments, as I was admitted to the hospital as an emergency. Following tests as an inpatient, I was scheduled for surgery. I was told that I had cancer in my ovaries, my bowel, my peritoneum, and I later discovered that the cancer was also in my liver. I had an abdominal full hysterectomy, a section of bowel removed, resulting in a stoma, and lymph nodes removed from the upper lining of my abdomen. Following my emergency surgery and my hospital stay and recovery, I attended an oncology appointment to discuss my onward treatment plan. Sitting in the Colney Centre waiting room, I really had no idea what to expect. I was told I should anticipate a 15-month survival and that my treatment would not be curative. Similar to Tracy, I went home, printed all the photos I hadn't already printed, and made photo albums for my 2 daughters. I needed to prepare for the worst. I cannot lie, this was without a doubt the darkest time in my life. Chemotherapy would start exactly 6 weeks following surgery and would consist of chemotherapy infusion every 3 weeks and chemo tablets twice daily. Chemo tablets are not to be underestimated, even though they are in tablet form. Then I would have a scan after 3 months to assess the situation. I left this appointment with my head spinning, masses of paperwork, leaflets, information, what to do with side effects in an emergency. I was literally terrified. I knew chemo was a necessary evil, but I was so filled with worry as to how I would cope and how it would make me feel. The first day of chemo arrived, strangely on Valentine's Day. I was filled with nerves and panic, but the nurses on the Weybourne unit were welcoming and comforting. They explained everything before we started, and I was given a named nurse to oversee my treatment that day. Those of you who are using the unit or do in the future, the unit has many friendly faces and always a doctor available if you have got further questions or need to be reviewed. Chemotherapy is a personal journey and it's an individual one. There are so many different types of chemo and everybody reacts differently. Therefore, it's important for people to try not to listen to the horror stories of others. For me personally, I became very proficient as I remained on various forms of chemotherapy and immunotherapy for 3 years. There were significant challenges during this time, both physically and mentally, but this treatment, though gruelling, transformed my life chances. Chemo has a cumulative effect, so it is normal that you will feel the impact more as the time passes. I had full trust in the staff at the Weybourne unit and in my amazing oncologist, who I have to big up. Despite having a recurrence of the cancer in my lung in 2016, which I had further surgery to remove, I am so very fortunate and blessed to say that my 15-month prognosis was definitely worst case scenario, as December 2023 marked my 11-year anniversary of my cancer diagnosis. My strength has always been and continues to be to survive to experience milestones with my children, who I'm thrilled to say are now 24 and soon to be 21. One of whom is here today. Another significant part of any cancer journey, and I wanted to talk about it today, is surveillance. Because the anxiety of routine CT or MRI scans is very, very real, and it's not to be underestimated. It doesn't get better the longer you survive. It just doesn't. My advice to anybody would be to try and keep busy, fill your time with activities that you enjoy, and trust in the process. We are so very fortunate here at the Norfolk and Norwich to have access to amazing cancer services, both within the hospital and affiliated support services, such as the Big C and the Macmillan Pod. I would encourage anyone to never be afraid to ask for advice and support, as there is so much available. Don't let fear, anxiety, or worry dominate your treatment. Share the burden with those that can help. Finally, without the skill and support of the professionals at this hospital and my family and my friends, I would certainly not be standing up here today.